Hello, friends, and welcome to another episode of Intentional Living with Emlah podcast. I hope you are having a wonderful week so far. And today I am deeply, deeply honored to have my friend, Dr. Bhavesh Patel, with us today. Thank you for coming.
Oh, thank you. Honor is mine to be here on your podcast. We've been talking about this for a long time.
We
and
have,
finally
we
made it
have,
happen.
we have. And I'm just so honored that you're able to take time off your work and be able to come here to the studio with us and sit down and talk to people who might otherwise not have the opportunity to have an appointment with you. With all the things you do, always marvels me. And you will find out by the end of this podcast why I admire Dr. Patel so much. So Dr. Bhavesh is, he is a board certified internist, but he does all the things. And my attraction to you, your work, is your ability to balance what you do, and always just seems so chill and so cool. Every time we connected on the parenting front. So we connected at Wellington, where our children both go, and working on a heritage festival, and so active. And I was like, I have a quick question for you before we get started. What does intentional living mean for you?
So intentional living, I have 4 pillars that we kind of base I usually kind of look at it.
Mm-hmm.
But at the end, you always have to keep family in mind. You have to make time for them. You have to make time for your kids because they will grow up very fast and you will miss out on that best time in their life. So no matter what we do, no matter how busy you are in your career, making time for family, making time for your kids is priority, no matter what. Now, when I look at intentional living for health-wise, I look at fitness, balanced nutrition, sleep, and mental health. Yes. So those 4 things has to come in play no matter what we do, no matter what medications you take, no matter what else you do. At the end, those are the bases that you do on a daily basis, every day. Those are things that you can easily do, but you have to set goals for it. But it's also understanding that you might not be able to meet that goal every time. Me knowing this, I cannot always meet those goals. But trying to reach that goal as close as possible, at least better than not doing it. But those are the base. So no matter what we do, everything else we do, any medications you take, will become a lot more effective when you have this 4 base in check.
You heard the doctor. The doctor said he thinks of intentional living and 4 things come to his mind. He thinks of fitness. He thinks of a balanced nutrition. He didn't say balanced diet. He said balanced nutrition because he thinks that is more wholesome. I love his choice of words there. He talked about sleep. We cannot skimp on sleep, my friends, if we're looking at whole health. And then the last thing that he talked about was mental health. So, and I cannot emphasize this enough. You heard the doctor. That's not from me. That's from him. And I always, and he talked about prioritizing family. And that's something that I always say. I am a great pharmacist because I'm a great mom, and I'm a great mom because I'm a great pharmacist. They go hand in hand. And that's something that I really admire. You and your wife are such practical people when it comes to this. And I just love how you're able to put together your work and your family and just continue to live it daily. And I heard, I was talking with a friend, I said, you're only with your doctor once in a few months, once or twice a year, but you're with yourself every single day. And you said those are the things that you do every day, and you just got to put in something to work towards one of these pillars every single day.
Absolutely.
It's not going to be perfect.
It's not. It's never perfect because life happens, kids' activities and all that. So life happens. So it doesn't mean that you have to be 100% do all that. But as long as you can get close to it, you're achieving something that will help you in longevity and overall health.
Yes. And you said life happens. One of the things that I'm particularly attracted to your work is because of the diverse places that you have your fingers in. Hospital, you are there, and direct primary care, you are there. You are looking at patients at different stages in their life where they need you, and you're able to able to put the community together. What is the difference in the patients that you see in hospital versus the ones that you see in your concierge practice?
So hospital medicine, I've been in hospital medicine since 2009, and obviously we take care of the sickest of sick patients who comes into the hospital. A majority of that is chronic disease management.
Yes.
So cardiovascular health, diabetes, high blood pressure, and complications related to that. We see stroke, heart attacks, all of that comes in too. But hospital is more chronic disease management. Patients who comes in also with hip fractures, we take care of them and during post-op period once their hip fracture gets repaired. But many different variety of disease management that we see. On the outpatient side, more we focus on is preventive measures.
Yes.
How can we prevent you from not ending up in a hospital? That's more focus on. Doesn't mean that it, again, works 100% of the time because it's based on your own body, on how you react to it.
Yes.
But in outpatient setting is more focusing on how can we prevent things from getting worse?
Okay.
How can we catch things early enough so we can prevent things from getting worse? How can we use other tools that we have, preventive measures that we have beyond what's recommended by insurance company that is available to you? And how can we interpret that data to prevent things from getting worse? And living more ahead of your health, staying ahead of it, and able to take care of the problem that's coming down the road. Now, as a primary care, I'm in every realm of where patient can be. So outpatient, hospital medicine, and I'm also a medical director of a skilled nursing rehab. So they have skilled rehab patients, long-term care patients, assisted living patients, memory care unit. So I kind of know every realm of health system that you end up in, which can help me, even in a patient in a hospital or in outpatient, I can explain them what this actually means. And in order for me to do that, I have to be in that situation rather than just explaining what it could be. And the other part also, we are also focused on men's health care. So we have a men's health clinic in Hilliard, which is more specialized towards men's health and doing very specific things. So as my career and my internal medicine, both certification allows me to be everywhere, and I want to be everywhere so I can know all the realms of health system.
That gives you one advantage, like over, several other physicians, because once you have that advantage, you've seen patients in all these different spaces and at different spaces in their life, you're able to bring that back to preventive medicine so that we are ahead of the game where we are so that we can help with that longevity and be able to lead a fulfilled life to optimize that healthcare.
Absolutely.
So when we talk about optimizing healthcare, one thing always comes to mind. The first question that patients ask is, we're limited by insurance in a lot of things. We're limited. Insurance dictates, because of the guidelines and insurance, and says insurance is only going to pay for this. Insurance is a prior authorization on this. Your diagnosis doesn't cover. We are put in those boxes. How do you work with your patients to be able to get out of those boxes so that you can truly offer me the best help that I can get from you as your patient?
And that's been the challenge of every physician dealing with insurance. They
don't teach you that in medical school?
No, they don't. Absolutely not. Business of medicine is not taught in medical school. And even in residency, you don't know how to even bill in residency. And as soon as the day you graduate, you got to learn how to bill now. But dealing with insurance is very frustrating, just to put it out there.
You said it out right.
I'm sorry.
Yes,
but it is very...
And that's not unique to you. Yeah, it's not just physician, it's pharmacist. That's one of my most difficult jobs. Explaining to a patient that the prescription that your doctor wrote is not covered by your insurance because it needs prior authorization. And they're like, no, my doctor authorized it already. My doctor wrote it for me.
Correct.
Yeah.
And it's because insurance rules and recommendations are based on business model, not actually taking care of the patient. So preventive measures are based on how much, if you put in place a preventive measure of let's say colonoscopy.
Yes.
That's based on, if we do 100,000 colonoscopy, how much money are we saving? And they have this data, they have these numbers that they can crunch and kind of figure it out. So preventive measures, which is recommended by insurance, is very limited, which is good. We still need to do that for sure. It's not that we should be ignoring any of it, but there's a lot more things out there for preventive measures that you can actually look into, but there's always pros and cons to all of that. For us, if I know about something and I know a few things that can be done beyond what insurance recommend, there is cash price for that. And we can be upfront about, hey, this is a cash price to check this, and this is what it's going to tell us. But these are the pros and cons of knowing this information also. For example, full body MRI. I'm not against it, but there's also something you have to understand, that full body MRI, you get it done, it looks for solid tumors. It cannot look for hematologic cancer like leukemia, lymphoma, and all that. Lymphoma sometimes can show up with the lymph nodes being enlarged. But what if you find a benign tumor? Now it sets in your brain, oh, I have a tumor. Now sometimes you have to do biopsy in order to figure out what it is. Is it benign or is it going to grow? So that leads to now an invasive procedure. Now you have to worry about complications. You have to worry about mental health while going through all that. So you have to be ready for that. And in case something like that is found, what is the next step? Full body MRI, I mean, there has been studies, patients found incidental findings, which we do that, which we find that in the hospital too a lot of times. Patient comes in with trauma, they end up getting a full body scan and, oh, by the way, you have this small pancreatic mass or kidney cancer growing, which you would have not known until they're big and problematic. But now you know it, like, okay, we'll stabilize you and this can be taken care of with surgery and you're cured from it. So those incidental finding does happen even in hospitals. So full body MRI can find something like that. And yes, it can be taken care of before it gets more problematic. But you have to be understanding also on the other side too.
What if?
What if something was found which could have not caused any problem, but now you're stuck with it and now you have to figure out what's going on with that.
I love how your brain reasons in like 10 different directions, but then always with the goal of taking care of the patient. I'm going to switch directions a little bit and go towards the men. That's one thing that, and over the course of the years talking with you, I've noticed that you're very passionate about men's health. But there's a lot of noise about women's health right now. And hey, we got to talk about our perimenopause and menopause and all this stuff. But one thing that you do focus a lot on is men's health. If a man is listening to us right now, what are some of the things that you usually say what I would do for a man, like priority and major screenings that a man in his midlife should be able to be looking at when just from a different perspective as prevention?
Well, with men, it's always hard to get them to see a doctor. That
You're
is
correct.
one thing, right?
Yes.
And it's not just because there are multiple reasons behind it, right? Men are providers. They need to take care of family, and that's their priority. So sometimes they put themselves last. But we see patients in a hospital sometimes comes in a bad shape, and we're like, so what brings you in here? And they'll sometimes point towards their wife. Say,
My wife sent me.
She brought me here. We're like, no, she didn't bring you here. She brought you here. There's a reason behind she brought you here. Because you haven't seen a doctor in decades, and now things have compounded significantly, and we need to take care of all that. So I think it's keep making time for yourself and just get it checked out. At least be in touch with your physician if something feels off, something's not happening. Midlife, as we hit 40s, something, female always experience perimenopause, menopause, and all that. For men also, there is something called andropause. It's not a really defined term.
Okay.
But it does kind of happen where testosterone level does drop and you can feel the effect of low energy, fatigue, like afternoon crash, not able to do executive function as you used to, not able to work out and feel like you worked out as you used to. So those are the things. And at the end also, well, one more thing would be libido. That can also go down. And those could be because of low testosterone.
Yes.
So it's a simple number check, knowing what your numbers are, and then kind of making a decision what you need to do afterward. But I think the first thing is do not ignore your health.
You heard the doctor. He said, as a man, first thing, do not ignore yourself. Do not put yourself last. When you're in the airplane, they say, put your oxygen mask first, take care of yourself first, and then you can take care of the people that are around you. So make that appointment. Make that appointment with your primary care provider. Go in, sit down, ask questions, understand what's going on with your health. And there is something called Andropause, which is not a common word.
Right.
A lot of people have not heard that word before, and you heard the doctor explain some of the symptoms and some of the things that happen to men. And these are things that you could measure your testosterone levels and have a conversation with Dr. Patel. We will put a link to how to get in contact with him in the show notes so that way you can be able to sit down and have a talk with somebody who does this all the time and who is trained to be able to take care of the men in such a way that we can prevent those things from happening down the line. So, and when we talk about this Andropause, I want you to talk about cardiovascular disease, because that's one of the things that we've talked about for men. Cardiovascular disease is the number one killer in the U.S. And what are your thoughts about what we could do?
Well, cardiovascular disease is the number one killer in men and women worldwide.
Yes.
So it's number one reason for death worldwide. Cardiovascular health, it still falls within fitness, balanced nutrition, sleep, and mental health.
He went back there. He went back to those foundations.
Those are the foundation for cardiovascular health. You have to do all that, again, to keep longevity, keep your heart healthy and able to function. If your heart is better, you're able to function better. And with that, when you do all those four things, it's not just cardiovascular health, it helps all the other organs on how you feel, your brain health, all that along with it too, along with decreasing risk of stroke or heart attacks. They all come because there are vascular problems to begin with. So when we look at cardiovascular health, the other things we look at, other than the four pillars that we have, blood pressure, managing blood pressure, kind of keeping an eye on it randomly just to kind of see how your blood pressure is doing. Diabetes check if you have diabetes, or at least keeping an eye on if you're becoming pre-diabetic or what your numbers are. Thyroid function. So those are very important. Now, in annual labs, we used to check TSH, which is your thyroid function, A1C to keep check of your diabetes. And then the third lab panel we used to do, which does do on an annual basis, which insurance does allow it, is fasting lipid profile. Fasting lipid profile includes total cholesterol, triglycerides, so those are considered to be bad cholesterol, HDL, which is a good cholesterol, and LDL, which is a calculated number based on cholesterol, triglyceride, and HDL. So those were the only numbers. LDL was the one we used to look at and look at the risk factor for heart disease with that. If you have heart disease, if you had a heart attack or stroke or high blood pressure, diabetes, there's a certain number LDL recommended to be at. And that has kind of grown, but LDL does not still give us a full picture. The example for that we sometimes see patients coming into the hospital with full-blown heart attack, and we check their LDL, and it's normal. And it's like, okay, well, then where is your risk factor at? So recently, there's more labs came into play, which can kind of point towards a little bit more on what could be happening. The first one is lipoprotein A. So until now, we used to say, well, you have family history if you have family history of early heart attacks, but we didn't have a way to measure it. So lipoprotein A is something you inherited. So that's a number, good to know. You don't have to do it every year. It's usually once in your adult life. That's all you need to know. The problem with that is we do not have medication currently directed towards it. There's some in ongoing research right now, so hopefully soon. But it is number. So if your number is high for that, again, the way to bring that down or decrease your risk related to that is fitness, balanced nutrition, sleep, mental health. So lipoprotein A is something you can get it checked. Any of the labs that I talk about, it's not very expensive, even than what insurance tells you. It is not expensive. So something you can still pay out of pocket. And I think some insurance are starting to look at it and maybe cover it, but it's always based on coverage. The other labs we look at that's been out there now is called apolipoprotein A, ApoA, which is a good cholesterol. So it's part of HDL. So higher the number on that is better. And the third one that is becoming very important is apolipoprotein B, which is ApoB. Now, that is part of the bad cholesterol. So in patients like I described, whose comes in with heart attack and has low LDL, they have high ApoB, and that's what their risk factor was. So how do you define ApoB? Well, consider LDL as like a cargo. It's a cargo, and ApoB is a truck. So ApoB transports that cargo, and the more trucks you have in your blood vessel, the more likelihood of clog happening or cholesterol emboli getting into the artery walls, and that leading to starting to have plaque buildup. So you could have a truck carrying 50% of the cargo, which is low LDL, but you have too many trucks on the highway, and that's what leads to clog, and that's what leads to heart attack. So those are the labs that are out there now that is available, easy to do. that can actually give you more better picture of your hyperlipid profile.
This podcast is sponsored by Journeys, your path to intentional wellness. Are you feeling fatigue, brain fog, low energy levels, and suspicion of inflammation? Most health problems don't start overnight, and neither does wellness. With Journeys, you can take charge of your health before you have to. Every cell in your body is whispering to you. But when we ignore preventive medicine, we wait until those cells are screaming. Journeys helps you listen to the whispers. There are 3 different lab test bundles to choose from. Starting at $199 up to $479, we measure up to 125 biomarkers, most that are typically not measured at your annual wellness visit. Normal labs is not a diagnosis. We get the most complete view, including hormones, nutrient markers that support energy, balance, and healthy aging. Each journey includes a personalized recommendation, one-on-one care from your pharmacist, and follow-up support to turn results into lasting intentional change. It's more than data. It's guidance, accountability, and a partner in your wellness journey. Intentional living means paying attention, staying curious, and taking steps towards the health you deserve. Start your journeys today. Click the link in the show notes. Oh my goodness, I love that. You heard Dr. Patel. This is my language. I love the fact that we speak the same language. So before now, the updated cholesterol guidelines talked about every individual should measure their lipoprotein little a at least once in a lifetime. If you are listening to this podcast and you have not measured your lipoprotein little a, there is going to be a link in the show notes to be able to measure that. This is a number that's important for us to know. And you heard Dr. Patel, there are no approved medications right now to be able to reduce that. But there are options and there are tools that doctor has in his back pocket that he can use. There are PCSK9 inhibitors, which in the studies, even though we're studying them for lipids, they have shown to be able to reduce some of these by up to like 28%. There's Repatha, there's Defendra, the new ones. Defendra just got approved. It's an oral one. If you're not fond of injecting, they are tools.
Yep.
So don't sit at home stressing out. Make an appointment with the doctor. You heard him say it. Don't wait until something bad happens and like, who brought you here? My wife. No. So what brought you here? Because you've waited and that cardiovascular risk has gotten to a point where you have a cardiovascular event. These things are preventable.
Yep.
Focus on those pillars, make an appointment with your doctor, and we have tools. Even if we know that your LP little a is high and we don't have an approved medication for it right now, we can hold your other risk factors to higher standards. We're going to be like, okay, your LDL should no longer be 100. We want your LDL to be 70. And that's what the new guidelines are. These are the things. Just don't sit in ignorance and fear, because these healthcare providers are here. This is why I love bringing people like you on. So you can explain. I love the truck and cargo analogy. That just makes ApoB like such a weird term, so understandable.
Yep.
Like, because there's more to your cardiovascular risk than your lipid panel, people. So there's all these other functions that you should be measuring in. I am so grateful to have you on today to talk about this. Like, it makes my heart happy. I want experts like you who are trained in the field, passionate about helping people to be able to articulate these things in a way that the common person can understand.
Right.
Somebody who was not in medical school with you. And we can understand and know how can I take care of my health? How can I take care of my father's health, my husband, my child, my brother, everybody? If you have a man in your life, your neighbor, your coworker, make sure that they're safe, they're not.
Correct. I mean, information is a key, right? Knowing your numbers kind of help you understand where you are. And it's there. So there are other things also that we can actually include within cardiovascular preventive measures. So these were the labs we talked about. Until now, everybody knows about stress tests, but stress test is when you actually have symptoms. So it's not a preventive measures per se. And it's also something you have to go in, you have to either inject a medication or you have to run on a treadmill and go through nuclear scan in order to look at that. And it's very expensive too. And insurance most of the time doesn't cover it unless you have symptoms. So the new thing in imaging, that two things kind of gaining a little more strength. One is CT calcium score. So CT calcium score is non-contrast, so you're not getting a contrast, and it's low radiation. Takes a few minutes to do it. It is CT, but it's not as expensive as you think it is. Now, again, there is always a little bit of a caveat you have to understand with CT calcium score. What it's measuring is the hardened plaque, calcified plaque. Now, if these are the ones that are actually stable. These are the ones that does not move. But that also represents that if you have those hardened plaques, it means there are soft plaques which are unstable and can move. The reason they're hardened plaques is because your body recognizes it and now they are trying to control it, and that's why they harden up so they don't move. But there are also soft plaques that are still out there that CT calcium score does not pick up. So the question is that, okay, well, if your calcium score is 0, that doesn't mean you have a 0 cardiovascular risk. There could be a soft plaque that we cannot see, but its decrease is telling you that your risks are low. If you have a positive calcium score, and positive calcium score could be anywhere from 1 to 3,000. So even if you have a score of 300, 400, 500, it is still telling you that your arteries are starting to build plaques. Your body already took care of some, but there could be something that we're not able to see. If your scores are high, like 1,000 and over, the higher the score, your risk of cardiovascular health goes up.
Dr. Patel, you knew this question was coming. How can we address soft plaque? How can we test soft plaque? How do we find out about soft plaque?
So soft plaques are difficult. So there's a test called CCTA cardiac, which is contrast based, a lot more expensive. So those are out there. Hopefully, as it gets more used, the price will come down on that. But again, there's a risk of contrast. You have to put an IV in, you have to inject a contrast dye, and have to have it read and kind of look at that way. Gold standard in any cardiovascular health is cardiac cath, which is invasive procedure. You go in, you want to prevent that from happening if you can know more information without putting a needle in you. And soft plaques, again, those are the plaques, those are cholesterol embolized, cholesterol plaques, those are building up. Again, goes back down to 4 pillars we talked about. And then at the end, medications. Statins are one of the oldest medications that can be used, but statins does have its own problem. Have to be careful when you take it, how it's tolerated, a side effects profile of that. And then other new medications that are coming out, like you talked about, Repatha and all that. So those can help decrease, well, I wouldn't say decrease the plaque. Those can help prevent it from getting worse. That's what you're looking for.
It is such a pleasure talking with you. We could talk forever, but our time is limited. I so appreciate you for talking about this and bringing awareness to this. This part of this cardiovascular disease so near and dear to my heart, because if you have a heart, this applies to you.
Yeah.
Everybody, we need to take care of our hearts because if it's really documented that cardiovascular disease is the #1 killer for men and women across the world. If you're talking about preventive medicine, we got to start with cardiovascular disease. And I love your passion and I love your ability to take those big words and explain it so that we can understand and know what to do. And I love how you break it down into those pillars. And I just want to thank you from the bottom of my heart for being here today with us. I really appreciate it.
Oh, thank you so much for having me. It was a pleasure.
I love it. I always say I spend time with all these smart people, and people think I'm so smart because I hang out with you guys and I get all these ways to be able to explain this stuff to patients. And so we can understand, we can know the tools that we can use. And if you have listened to this episode and it has resonated with you, please do me a favor, share this. We cannot do this alone. We talked about positive social connections and mental health. We got to take care of ourselves and take care of somebody else. So share this podcast with somebody else who does have a heart so that way they can know how to protect their heart from cardiovascular disease and to be able to see all the things that Dr. Patel talked about. Today, we're going to put a link in the show notes for all his services and how you can get in contact with him and schedule an appointment with him so you have him all to yourself and he can give you all this education and the tools to be able to take care of your life in that. And thank you. As always, continue to live each day with gratitude and intention. Be kind to yourself.